Let's discuss about today's topic, abortion. What is abortion?
An abortion is a procedure to end a pregnancy. It's also sometimes known as a termination of pregnancy. The pregnancy is ended either by taking medicines or having a surgical procedure. In other words, abortion, the expulsion of a fetus from the uterus before it has reached the stage of viability. In human beings, usually about the 20th week of gestation. An abortion may occur spontaneously, in which case it is also called a miscarriage, or it may be brought on purposefully, in which case it is often called an induced abortion.
How to get an abortion?
Abortion in India has been legal under various circumstances for the last 50 years with the introduction of Medical Termination of Pregnancy (MTP) Act in 1971. The act was amended in 2003 to enable women's accessibility to safe and legal abortion services. The best and reputed nearest hospital, which is registered with the government, can fulfill your requirement. All procedures are done in a legal way, with full confidentiality. To recommend one, Vardhan Hospital, B100 Malviya Nagar, New Delhi, India is the safest hospital. The nearest airport is Indira Gandhi International Airport. You can check such type of info according to your country, and you can get one of the best, secure hospital near you.
What happens during an abortion?
Before having an abortion, you will have an appointment to talk about your decision and what happens next. Whenever possible, you should be given a choice of how you would like the abortion to be carried out. Medical abortion, abortion pill. You take 2 medicines, usually 24 to 48 hours apart, to induce an abortion. Surgical abortion, you have a procedure to remove the pregnancy and normally go home soon afterwards. After an abortion, you will probably need to take things easy for a few days. It's likely you will have some discomfort and vaginal bleeding for up to 2 weeks.
Methods of abortion.
Here are some methods for an abortion. But before going to do anything like this, actually, you need to talk with yourself, your near and dear ones, or your doctor. Early medication abortion method, early pregnancy, up to 7-9 weeks gestation. A woman in very early pregnancy may have the option of an abortion that uses medicine instead of a surgical abortion. Suction curettage, aspiration, early pregnancy 6-14 weeks gestation. The vagina is cleaned with a liquid soap. A shot to numb the cervix is given. Then the cervix is dilated, opened by stretching. A tube attached to a suction machine is put into the uterus. The uterus is then emptied by suction. Dilation and evacuation, early pregnancy 12-24 weeks gestation. This is the most common method used after 12 weeks of pregnancy. The vagina is cleaned with the liquid soap. Induction of labor, advanced pregnancy. Emptying of the uterus by induction of labor is usually done in the hospital. First, the cervix must be prepared by making it softer. Hysterectomy, cesarean delivery, advanced pregnancy, after 24 weeks gestation. In rare cases where the induction method fails or cannot be used, a surgical method called hysterectomy must be used. Hysterectomy means to cut open the uterus. It is like a cesarean delivery and has the same risks.
Risk of an abortion.
Abortion is a safe procedure. Abortions are safest, and happen with less pain and bleeding when carried out as early as possible in pregnancy. Most women will not experience any problems, but there is a small risk of complications, such as infection of the womb, uterus, some of the pregnancy remaining in the womb, excessive bleeding, damage to the womb, or entrance of the womb, cervix. If complications do occur, you may need further treatment, including surgery. Having an abortion will not affect your chances of becoming pregnant again and having normal pregnancies in the future. You may be able to get pregnant immediately after an abortion. You should use contraception, if you do not want to get pregnant. Top 6 countries with the highest abortion rates annually per 1,000 women. United Nations, Russia, Kazakhstan, Romania, Ukraine, Cuba, China. You know what? According to the World Health Organization, roughly 73 million induced abortions occur worldwide each year, with 61% of all unintended pregnancies and 29% of all pregnancies in general ending with an abortion. The WHO also keeps a database of each country's abortion laws, policies, and level of abortion support in the healthcare system. Abortion in India has been legal, under various circumstances for the last 50 years with the introduction of Medical Termination of Pregnancy (MTP) Act in 1971. The act was amended in 2003 to enable women's accessibility to safe and legal abortion services.